Representative, welcome back to the program. Many women say they expected a lot more from the Texas Medical Board. How much clarity did they really provide?
Well, thank you for having me. I don't think that it's as much as people were expecting. This is a regulatory agency. Every single member of this board was appointed by Governor Abbott. So these are, people who were sent there or placed there to pretty much who are in line with the philosophy of the governor. The regulatory agency did not really provide as much guideline as people expected. Um, and they could have, though. They could have provided more clarity because they've done that in the past. But they didn't really set out, they just piecemealed some regulations or laws that were already in place, and they put them together to provide a framework of how they will address any complaints that are filed against a physician that are filed with this entity, the Texas Medical Board. They have something in place, a proposal in place. The public has 30 days to comment on it, and then they'll make the final rule on how they're going to address the medical exceptions to abortion.
Do you expect anything to change in that 30-day period?
I hope so. I hope they'll give a little bit more clarity. Now they're getting more feedback from those who are under the jurisdiction of the Texas Medical Board, and they're letting them know that, look, this is not enough. This is not enough guidance. We'd like to have more clarity. Because keep in mind, if somebody's filing a complaint against the physician with the Texas Medical Board, it's going to impact their license, their ability to, their livelihood, basically. And so they want to know what they are obligated to uphold in terms of the standard of care, what the expectations are, and they're asking the Texas Medical Board to provide more clarity. I'll give you an example. The Texas Medical Board, when the law was passed about telemedicine, the Texas Medical Board provided more concrete examples of what a doctor would be expected to do in terms to qualify for a telemedicine visit, a telehealth visit. They've done that with opioid use. They've provided, the different schedules and how the prescription method needs to be done. So they have done it in the past to provide additional details. They just haven't done it yet in terms of the medical exceptions for abortion.
Why not? Is this all politics because these are Abbott appointees, or is there something else going on here? Do they not want to wade into that?
Well, it's a complex issue. I do acknowledge and realize that you don't have an answer to every single situation and circumstance. So you do want to have a little bit of room in there. You want to have some room in there so that way the decision can be made on the evidence that is in front of them. So you don't want to just box them into one, a list of scenarios that qualify. You want to have that ability to argue a medical exception existed. But, let them know, how did you come up with the medical exception? What was the major bodily organ that was impacted? Those are the exceptions to medical abortion. And being able to give them an example without saying that the list is exhaustive would have been helpful. And again, they're not done yet. The public has 30 days from the date of the last Friday. So 30 days from the 22nd to submit comments to the proposed rule, and they can take those into account to come up with the final rule that will be in place.
Do you think this final rule in place is really going to change things? Do you think doctors are going to say, hey, this is enough cover for me in the law to actually perform an abortion because a woman's life is on the line here? Women have been traveling out of state for these types of situations. Is anything going to change now?
Uh, Unfortunately, I don't think that we could put this on the Texas Medical Board to make changes. This is something that the legislature, is obligated to do and should do. I don't believe that the legislature should be led, making laws over a woman's right to choose, their freedom to choose, their health, to make personal health decisions. I don't think that it's up to the Texas Medical Board to provide these concrete answers that we need for individual autonomy. But they could help provide guidance. There's no one answer for physicians. We're not going to be able to
Sure.
answer every single scenario. So I think that we need to look at the legislature and not so much as putting more pressure on the Texas Medical Board to give us these answers. But the physicians, they need to participate in the process. The public, participate in the process. Let them know where you stand on this issue, and then even give them suggestions on how they could improve this rule so that it's more meaningful for those that are under its jurisdiction.
What do you think realistically the legislature might do with this? Are they going to tweak anything with this to try to put more concrete examples in there, specifics for doctors to follow, guidelines for them to follow?
I doubt it. In fact, I mean, I'd rather they just leave this alone. I mean, if we can't improve the law and provide medical autonomy for people who are impacted by the law, then let's just leave it alone. I'd rather they not touch it because it could only get worse, in my opinion. So I don't want them dealing with this because we saw last session uh, proposals that would charge a person with murder if they sought an abortion service or if they, completed an abortion. I don't want to touch that. I don't want to have anything to do with that. I think that exceeds government authority when you're talking about this medical autonomy. So I'd rather not have anything else that deals with abortion. Every year that I've been in there in the legislature, they've chipped away at the freedom to choose, and now it's just completely gone. So I just rather not touch it at all.
Speaker Dade Phelan, as you know, is fighting for his political life in that runoff in May. The Republican Party of Texas moving further to the right, the grassroots of the GOP moving further to the right. Considering that, considering what we saw on Super Tuesday, what do you expect the next legislative session to look like come January?
That depends on who's speaker. I will say that Dade Phelan is the current speaker. He's in a runoff. Each session we have to elect a new speaker. Depending on who that is, will pretty much dictate the flow of policy and what comes to the floor.
Can
Um,
Phelan
I,
survive that runoff, do you think?
I don't know. I was in a meeting and I heard, that 6 to 8% of incumbents who are in a primary runoff, that's the percentage that wins, 6 to 8%. Perhaps he can. I'm not familiar with what's going on in that area of Texas,
Yeah.
but I'm sure he's working his best to get reelected. The question is, what happens if he is reelected?
Yeah, indeed. So a lot to come, Representative. We appreciate the time. Thank you.
Thank you.